So with about 1 in every 3 South Africans directly benefiting from a social grant, government spending on social assistance is above the global average. So on average, 180 billion rand, or 3.3% of GDP, is spent on child support, elderly and disability grants, etc. But a social safety net for people of working age was found to be limited in its coverage. Brenton van Vrede is the Chief Director of Social Assistance at the Department of Social Development. He joins us now more to elaborate on this type of spending. Brenton, thanks very much for joining us on this Monday morning. So the World Bank review gave a number of findings around South Africa's social assistance programs. Overall, how are we faring?
Good morning, Michelle, and good morning to your viewers. I think the report on the overall is quite positive. It basically says that the South African social system is quite effective, but it does also point to a couple of shortcomings. So on the positive side, amongst many findings, one of the key findings, some of the key findings, I think, is that it finds that the South African system is well targeted. So it does reach the poor, it does cover a large number of poor people, and it provides sizable cash transfers to these households. It also finds that it's very effective at reducing poverty, and it goes into quite detailed technical analysis on the extent to which it reduces poverty, but not just poverty. It also finds that it's quite effective at reducing inequality. But it also also finds that amongst not just the sort of the income effects, that that also has very positive effects on other issues, other elements such as nutrition and food security, health attainment, health outcomes, and also labor supply. So it has quite a positive effect on the labor supply of our country as well. On the negative side, I think one of the key findings is that, as you sort of mentioned in your introduction, the system only really provides access to about just over 30, just under 40 actually % of the population, with a large portion of the population, or the biggest cohort of the population, which is namely your working age, or what we classify as the working age population, and those between 18 and 60. They don't really have access to any form of social assistance, notwithstanding the recent COVID interventions that we've made. And the report also does point out that we need to have better linkages with other government departments and other governance services, so that we can strengthen the overall social wage that government provides to its people.
Yeah, it also talks about weaknesses in the delivery systems. Is that just the way that people are able to access the money?
Yes, so largely those weaknesses are, so that last point I've made, which speaks to better integration of our various government databases, so that we could, for example, one shouldn't necessarily ask people for an ID document. We should be able to integrate directly with Home Affairs, and once you have the person's name, all the details, or once someone gives you an ID, you can automatically just pull up a picture and confirm everything about the person that's on their Home Affairs database, or even if they have data captured in any other database, you should be able to just easily be able to pull that data and make life and the application process a lot easier for people, and also allow for more electronic processing, so that you don't have the face-to-face, especially in this COVID environment, which I think as government, this report was done before COVID, so I think we've actually made a lot of strides in that area. As a result of COVID, we were forced to implement many of these digital systems that the report is sort of alluding to.
I actually was going to ask you that, how far have we come in terms of integrating various government departments? Is that a program that is still sort of in the pipeline? It's not at the peak of where it should be at the moment?
I would say it's in between the two. It's not at its peak. It's still developing, but we've already come quite a long way. So if you may have you may recall that since last year we've implemented a COVID-19 SRD, social relief of distress grant, which is almost entirely, well, actually it is entirely digital. It has no face-to-face interaction, simply because of the environment we're operating in. And that has actually enabled us to be a lot more not responsive, but able to reach a lot more people a lot quicker. But given the circumstances that we had to implement it, we had to basically develop implement and test all at the same time. So the system isn't perfect. As we're implementing, we're still working on it and trying to improve it. We have had some significant data challenges, especially with our integration, for example, with other government departments like UIF, SARS, government employees' pensions, and government workers. So there has been challenges, and a lot of the challenges you probably have seen in the media in the last couple of months or so.
Yeah. I want to go back to a point that you made at the start of our interview, Brenton, around how well targeted and how effective our social grant system is in the country. So you've named a number of points, effective at reducing poverty and inequality. There's also a positive effect on things like nutrition. Are these positive points quite marginal? I mean, the money that we're talking about here is not a lot of money insofar as if it's the only income I'm getting, how much of a difference is it really making in my life?
Yes, so it is at the individual level, yes, it is that the transfers are quite small. Well, some of the transfers are quite small. So, for example, the child support grant is a very small transfer to caregivers. We acknowledge that it's below the food poverty line. However, on the other side, the disability grant and the old age grant are larger transfers. They not only above the poverty line, but also above the upper bound poverty line, quite significantly. So, for example, the upper bound poverty line is 1,335 rands. The old age grant is 1,890 rands. So it's about 600 rands more than the upper bound poverty line. So overall, when you put them together, it makes actually a very, very significant reduction in poverty. I think the World Bank report said it reduces poverty by about 40%, and it reduces inequality also substantially. I think our Gini coefficient would be 0.76, and it reduces it to about 0.65. So we have a market level Gini coefficient, which is very, very high. But with these transfers and a progressive tax system, we are actually able to bring it down substantially. But we're still a very unequal country, so still a lot more still needs to be done. But yes, you are correct that some of our grants at the individual level are also quite small.
And then in terms of if we were to compare South Africa with a country with similar records of poverty and unemployment in particular, how do we fare?
So based on the World Bank report, we actually fare quite well. We sort of at the, amongst the top in most of the countries when you compare us to upper middle income countries, or even when you compare us to developed countries, we do very well in terms of our impacts on poverty and inequality.
The future of our social grant system, Brenton, insofar as the percentage of our GDP that's used towards this incredibly important tool in, as you say, reducing poverty and various other social ills we're facing in the country, what do the next sort of 10 to 20 years look like for us?
So at the moment, our transfer program has more or less stabilized at about 3.5%, between 3.3% 3.5% of GDP, notwithstanding the sort of current recession that we're in. So obviously, GDP being the denominator in the equation, if the GDP suddenly goes in a negative direction, things can suddenly get quite a lot worse for you. But assuming GDP growth returns, we will be relatively stable at that, and we've been at that level for almost a decade, so quite long. The last time we've seen sort of increases in that grants to GDP ratio was when we sort of had that government program of implementing the child support grant and rolling that out from initially we started 0 to 7, and we rolled it out to everyone up to the age of 18. So that's sort of what took us to that 3% level. I do think we have a need, and I think that's quite well acknowledged within society, that we need to provide income support to those between the ages of 18 and 60. And closing that gap is something we've already done during the COVID period with the COVID SRT grant. That has cost us last year about an extra 55 billion rands. This year we're spending about 27 billion rands. Last year we did a little bit more than just the COVID grant. But that is estimated overall to cost somewhere between, at a low level that we're currently doing at the COVID grant level, it will estimated cost around 50 billion rands. And that could add probably another 0.5% to 1% to the sort of overall ratio of grants to GDP, which is sort of, I think, still sort of in a very sort of stable position, if that is something our country wants to do.
I mean, Brenton, it takes place in what is an already quite constrained fiscal environment in South Africa. We don't have a lot of room to maneuver. We've incorporated some of our social grant spend in response to COVID-19. I mean, is there flexibility in terms of a policy to address what will be a post-COVID South Africa in the months and years to come?
I think there is flexibility. I mean, obviously that's a debatable subject. Many may argue not. From the department side, I think the flexibility is not so much about whether there is money to do this and if there's trade-offs with other items that needs to be made, but really just about, looking at our levels of inequality in our country, looking at the amount of money that we have, especially when you express it, as you sort of expressed it, as a grant to GDP ratio. It's really about what we're comfortable with. Spending 3.5% of your grants and grants to GDP or 4.5% isn't really about new money. It's just about how you divide the pie, and it's really about people's willingness to share. So, we are, like I said, a very unequal country. Most of our income goes to the top 10%. That does create a lot of instability in our country. For example, you saw what happened in July 2021 when government tried to withdraw the COVID grant, or when government did withdraw the COVID grant in April. So it's beneficial, I think, for the country as a whole, both for the rich and poor, to divide its resources a lot more fairly and make sure that nobody in your country, at least nobody in your country, is going hungry.
Brenton van Vrede, thanks very much indeed for talking to us about this incredibly important issue. He's Chief Director for Social Assistance in the Department of Social Development. Thanks for your time this morning.